maintaining social distancing while out in public and practicing good hygiene. At the same time, my administration is focused on our economic recovery as well. Earlier this week, the Department of Children and Families awarded just over $32 million to 2,367 early care and education providers through the first period of the Child Care Counts COVID-19 Emergency Payment Plan. The Child Care Counts program addresses a nearly universal desire to help early care educators by supporting the costs of providing care for essential workforce families, offering incentive pay for child care providers and individual educators, and assisting providers who are forced to close with the cost that is associated with retaining staff and reopening child care programs. Thousands of early care and education providers and educators stepped up in this time of crisis. Unfortunately, many of those folks are now struggling in the wake of the pandemic. Our Child Care Counts payment program is a key part of making sure families have access to safe, high quality, and affordable child care. The second application period is open through June 19, so I encourage folks to visit the DCF website at dcf.wisconsin.gov to learn more and apply today. Today, I'm also happy to announce that in consultation with the Wisconsin Hospital Association, the state will be awarding $40 million in financial assistance to Wisconsin hospitals from the Federal CARES Act funding. These funds will help hospitals make up for lost revenue and extra expenses due to the COVID-19 pandemic. Losses and expenses from March, April, and May will be eligible for reimbursement if they have not already been reimbursed by other federal programs or insurance. Each hospital will receive funds calculated using the relative percentage of Medicaid claims paid to that hospital in comparison to all Wisconsin Medicaid claims. And we expect to make these payments by the second week in July. The work of Wisconsin hospitals is life-saving work, whether during a pandemic or not. But due to the COVID-19 pandemic, we know hospitals are stretched thin. This funding will help alleviate the financial strain felt by these hospitals and make it possible for them to continue their essential work. You know, this pandemic has also reminded us health care should not be a privilege afforded by only the healthy and the wealthy. In order for our communities to stay healthy, everyone must have access to the care they need. Covering more folks and saving Wisconsin tax dollars remains one of my top priorities. We know that 70% of Wisconsin voters support expanding Medicaid. The people of the state want us to bring federal money back into our communities under the Medicaid expansion program and reinvest those dollars into our health care system. By expanding Medicaid in Wisconsin, we can improve access to quality, affordable health care for people across our state, and importantly, help address disparate health outcomes for people of color. You know, we cannot ignore these disparities. We must continue to have necessary and important conversations about the harm caused by systemic racism, and we must take action. So I want to personally thank the peaceful protesters who continue to make their voices heard around the state of Wisconsin and the nation for keeping this conversation going and demanding change. These demonstrations are important, but if you've been out in large groups, it's possible you've been exposed to COVID-19. You can help everyone stay healthy and safe by getting tested, monitoring yourself for symptoms, continuing practicing social distancing, and always wearing a mask in public. You should monitor yourself for COVID-19 symptoms such as cough, fever, shortness of breath, chills, headache, sore throat, runny nose, and muscle pain. If you are experiencing any of these symptoms, get tested immediately. Otherwise, even if you feel healthy, it's a good idea to get tested 5 to 7 days after the event of possible exposure. You can get tested for free at a local testing site in your community. If the first test is negative, you should get tested again in 12 to 14 days. And now I'll hand it over to Secretary-Designee Andrea Palm for her COVID-19 update.
Good afternoon, everyone, and thank you for joining us again today. Earlier this week, we announced changes to the eligibility requirements for the Emergency Food Assistance Program, making it possible for more Wisconsinites to access nutritious food. This program provides locally grown food, including meat, fresh vegetables, and fruit, juice, and more to individuals and families through TFAP food pantries. Every county in Wisconsin has at least one TFAP food pantry, and enrollment at a pantry is confidential. We encourage you to visit the TFAP page on the DHS website to find out more information about eligibility and to find a pantry in your area. Today we are also announcing a $675,000 grant from FEMA to fund crisis counseling services for people experiencing heightened anxiety and stress during the COVID-19 pandemic. DHS is partnering with the Wisconsin Community Action Program Association to bring these services to some of our hardest hit counties. And we are also applying for a grant to expand these services to more counties across the state. These counseling services will be available in the coming weeks, and we will share more information as soon as the program is up and running. We know this is a stressful time, so this is a good reminder for each of us that our mental and emotional health and well-being need attention just like our physical health. I know I often remind you of the symptoms of COVID-19 in these briefings, and they are important to know because you need to get a test if you are experiencing them. But I also want you to know that if you are experiencing stress or are having trouble concentrating, feeling anxious or overwhelmed, that there is help available. Resilient.wisconsin.gov can help with coping strategies and provide resources like information and helplines and links to virtual meetings. It's okay to ask for help. In fact, I encourage it. I want to give you an update now on where our numbers stand. We have 66 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 16,153 tests. We have 366,054 negative tests, which is an increase of 8,942 over yesterday. There are now 21,296 confirmed cases of COVID-19 in Wisconsin, which is an increase of 333. Our total deaths have now reached 682. COVID-19 is still present and spreading in Wisconsin, and we need to remember to continue best public health practices. Wash your hands for 20 seconds, practice physical distancing. When you take your essential trips, wear a cloth face covering if possible. When you get outside to enjoy the lovely weather, please stay 6 feet apart. And if you're experiencing any symptoms or if you've been exposed to COVID-19, please get a test. And remember, it's okay to ask for help. Thank you for all you are doing to help keep Wisconsin healthy